Let's talk about something that affects almost every family, every community, and probably even you or someone you love right now. High blood pressure. Half of all adults in the world today are living with it. That's right, 50%. Yet here's the surprising part. Most of them don't even know they have it. And that's what makes high blood pressure so dangerous. It creeps in silently, doing damage behind the scenes, until one day, boom, it shows up as a heart attack, a stroke, or kidney failure. But here's the truth I want you to take away today. You can lower your blood pressure naturally, not with more pills, not with endless side effects, but with simple, everyday choices. And in this video, we'll break it all down. What high blood pressure really is, why it's dangerous, what truly causes it, and most importantly, how you can begin to lower it naturally with the power of herbs, spices, seeds, nuts, and even dried fruits. 1. What is high blood pressure? Blood pressure is simply the force of blood pushing against the walls of your arteries as your heart pumps. Every time your heart beats, it squeezes blood out with a certain pressure that's called the systolic pressure. Then, when your heart rests between beats, the pressure falls. That's called the diastolic pressure. When you go to the hospital or pharmacy and check your BP, you'll see two numbers. For example, 120/80. The top number is systolic, the bottom is diastolic. Now here's the line you don't want to cross. Anything consistently above 130/80 is considered elevated. And the higher it goes, the greater the risk. But numbers don't tell the whole story. Context matters. Your diet, stress levels, sleep, and even your age all play a role in how dangerous that number really is. Take John, for example. He's 45, works long hours in an office, eats fast food for lunch, and rarely checks his blood pressure. One day he goes for a routine checkup and finds his BP is 150/95. He feels fine, but inside, his arteries are under heavy strain. John's story is common. People feel normal, but are already at risk of stroke and heart disease. 2. Why high blood pressure is dangerous. Now, why do doctors call it the silent killer? Because unlike a fever, unlike pain, unlike most illnesses, high blood pressure usually doesn't announce itself. You don't feel it creeping up. Most people walk around with dangerously high readings and feel perfectly fine, until suddenly, damage shows itself. Here's what can happen when high blood pressure is left unchecked. It damages your arteries, making them stiff and narrow. It strains your heart, forcing it to work overtime. It raises your risk of stroke, aneurysm, kidney failure, and even blindness.